Hello, my name is Michael West. I've had the privilege of conducting research within the health service over the last 30 years to try to understand how we can create effective healthcare teams and organisations that deliver high quality care to people in our communities. I'm currently Senior Fellow in the King's Fund and Professor of Organisational Psychology at Lancaster University. The health service today is characterised by some very considerable challenges. We're all aware of the difficulties of finding adequate funding, the increasing complexity of the problems that people present with in the National Health Service, an ageing population, and just the complexity of the National Health Service overall. I think we're also in danger, as we try to respond to those challenges, of damaging the health and well-being of those who we ask to deliver health and care to our communities. So at least 50% more staff in the NHS report debilitating levels of work stress compared with the general working population as a whole. And something like 35–40% of NHS staff report being unwell as a result of work-related stress every year. And it's not surprising that only about 40% of staff say that they feel satisfied with the quality of care that they're able to deliver. And these circumstances do affect quality of care. We know that when people are under high pressure, feel high levels of stress, that affects error rates, it affects people's ability to be compassionate, and in the acute sector, we know it's associated with higher levels of patient mortality. So that presents real challenges to us, not just in terms of running these organisations that deliver health and care, but caring for the health and well-being and the growth and the development of people who work in the NHS also. When the NHS was set up and created in 1948, it was a result of a society reflecting on itself right after a major war, and there was a commitment made to providing free health care services to everyone regardless of their background, their wealth, their status, their prestige. And that, I think, reflected a core value of compassion in society at that time, and we've continued to really protect and want to develop the health service ever since because of a core national value of compassion. And the vast majority of NHS staff made a decision at some point to dedicate an enormous part of their precious, unique lives to caring for the health and well-being of their fellow human beings in their communities. So their core work value also is compassion. And when health service staff are able to deliver compassionate care, patients are more satisfied, and that in turn leads to higher levels of well-being and commitment amongst NHS staff. So we need to nurture cultures in the NHS where staff can deliver high quality, continually improving and compassionate care. And that, I think, at core requires NHS leaders to model compassion in their leadership. So what is compassionate leadership? Well, first let's understand what we mean by compassion. Compassion, I think, has four components. The first is, if we're with someone who is in distress, then the first element of compassion is paying attention, is being present with the other person. To use Nancy Kline's wonderful phrase, it's listening with fascination. Second is understanding the causes of their distress. And third is having an empathic response, feeling their distress at some level without being overwhelmed by it, in order that we then have the motivation for the fourth step, which is helping the other person with their distress. So what does this mean for us in a day-to-day sense as leaders? It means, I think, that we hold in our understanding these four behaviours and seek to practice them every day through our leadership, in our interactions with those we lead, but also in our interactions with peers and colleagues as well as with patients. So the first and most important step is learning to be present with the other. remembering to be present with the other, being mindful of being present, and listening with fascination. And in that way we establish the basis for understanding of the other's position, which then evokes empathy, which then leads us to be in a position where we can take intelligent, thoughtful, informed action to help.